I knew it existed, but I didn't know how extensive it was.
Discrimination in Alzheimer's and dementia care. A newly released report puts the data behind what some say they already knew when it comes to the attitudes on Alzheimer's and dementia care in minority communities. Our Nikki Dementri with that story tonight.
It is a very serious disease, very serious. The more I learn about it, the more I hate it.
It's a disease that has personally touched Molly and Ralph Richards. Molly's dad lived with dementia for 12 years, and Ralph's good friend died from Alzheimer's.
We realized that people had no idea what Alzheimer's was, didn't know about resources, and a lot of the groups that we spoke to were predominantly African American, and they had no information.
A disease the Central Indiana couple are dedicating their retirement to in trying to build trust, spread awareness, and encourage research, particularly in the Black and brown communities.
I think that things are changing. It hasn't changed, it is changing, and only because that we're finding it's getting more press. The Alzheimer's Association is becoming more sensitive to having people to talk to the people in the community that looks just like them. And that's where we come in.
A newly released report called Race, Ethnicity, and Alzheimer's in America examines attitudes towards Alzheimer's and dementia care among minority communities.
I was happy that the information that I had felt in my heart was in print, but I was sad that it was true.
The report found 66% of Black Americans, 40% of Native Americans, 39% of Hispanic Americans, and 34% of Asian Americans believe it's harder to gain access to excellent care for Alzheimer's and dementia. It also details data describing a lack of trust and confidence in things like medical research and finding a cure.
See it in black and white and saying, gee, you mean 50% of African Americans feel discriminated when they visit their physician?
Lead by example. For years, the couple has volunteered as community educators. Molly is also participating in local research. And the Richards say they hope the data and findings from this report inspires change.
We need to educate the community. We need to be promoting more minority young people to become more a part of research and also different medical specialties.
Working for you, Nikki Dementri, WRTV.
Well, both the Richards and the Alzheimer's Association want to remind Hoosiers there are resources available. The 24/7, 365-day-a-year helpline can be reached at 1-800-272-3900. It's on your screen.